Okay. Good afternoon, everyone. I'm pleased to see so many of you join from around the world for today's webinar. I'm Daniel from ISWA, and I'm moderating today's session reflecting on 1 year of COVID-19 from a waste management perspective. It was about a year ago that we organized our very first of what became a regular webinar series on various topics for this industry. Just before, about a year ago, we were used to doing our events, trainings, conferences in person, and I think we've learned a lot over the last year about what we can do online and how to share information and knowledge and deal with the needs of the industry without even stepping out of our own homes. And whilst we're desperate to get back to some form of normality, I think that we can be positive about some of the things that we've learned over the last year. And at ISWA, we'll continue to offer more and more digital content no matter what happens in the future. Today's webinar, to some extent, will be a reflective one, but also one which uses the experiences of the last year to ensure that the new normal is a more positive one, with more emphasis on the important role of waste management in public health. Also, the positive role that waste management will play in climate change mitigation, the improved status of waste workers, and hopefully better conditions overall for this industry. We'll consider the conclusions we made 12 months ago and assess whether the industry has been able to keep waste management uninterrupted, safe, and focused on protecting public health. We'll be joined by 5 experts from around the world who will briefly introduce and discuss the topic, followed by a short Q&A with the audience. So I encourage you to type your questions into the tab to the right of your screen, and we'll try to answer as many as possible. So before I introduce you to speakers, I will quickly introduce you to ISWA, since some of you joining today are not yet members. First of all, I'd like to recognize our sponsors, who are Veolia, the City of Rotterdam, IFAD, and Ecomondo, and also a quick thank you to all of our Platinum members. This webinar comes to you for free. We make it free because part of ISWA's mission is the development of sustainable waste management through education and training, and we want to promote appropriate and best available technologies and practices and ensure that proper waste management is available to all. However, we do rely on the support of our members to be able to do this, and I know that some of you joining today are not yet members, so I encourage you to go to our website and check out our membership offer, sign up, or just contact me directly. And for those of you unfamiliar with ISWA, and I do hope you're few, we're a global independent non-profit association working in the public interest to promote and develop sustainable waste management worldwide. We have members in 110 countries, representing the public and private sectors, academia, non-governmental organizations, and even individuals with a passion for waste. So if you share our vision and mission, then please join us. And with that, I would like to introduce you to our speakers. So I will say your name, and then if you quickly introduce yourself to the audience. We'll start with Carlos.
Hi, Daniel. Thank you very much. Thank you, everyone who joined us and is following ISWA. I'm Carlos Silva Filho. I'm Brazilian. I'm currently the ISWA president and also president of the Brazilian Association of Waste Management Companies. And I really look forward to this discussion today with our members, board members, and friends from different parts of the world. Thank you very much. And we'll be speaking soon.
Thank you. And Woolridge.
Hi, thank you. I'm Anne Woolridge. I am the chair of the Healthcare Waste Working Group. It's been a rather busy year for me because I work in healthcare waste. So I'm currently working with our Department for Health and Social Care and also our NHS. One of the main things I've been doing through the year is classification of wastes, including that from all the testing devices and the vaccination program, which is global. So I've been a bit busy.
Thank you, Anne. Björn.
Hi, everybody. My name is Björn Appelqvist. I'm the chair of the ISWA Scientific and Technical Committee that coordinates the work of our working groups. And my day job is with Ramboll, a consultancy company in sustainability, engineering, and architecture, where I run the waste and resource management department out of our head office in Copenhagen, Denmark.
Thanks, Björn. David.
Good morning, everybody, and good afternoon to those of you in Europe. My name is David Biederman. I'm the Executive Director and CEO for SWANA, the Solid Waste Association of North America, which represents the waste industry in both the United States and Canada. Happy Earth Day to everyone, and thank you to ISWA, not just for holding this important webinar, but for inviting me to participate. I really, really do appreciate it. We are continuing to help the industry respond to the impact of COVID-19 and look forward to a fruitful discussion here today. SWANA is the national member to ISWA from both the United States and Canada. Thank you.
Thank you, David. And finally, Anna.
Hello, everybody. Greetings from Portugal. My name is Ana Loureiro. I am an ISWA National Member Representative, and in my day job, I'm the Corporate Communication Director of Communication in EGF, which is a waste management company in Portugal. So I'm very looking forward to have this roundtable, and thank you, ISWA, for promoting it. And my day job is to work with people, for the people, and about all these matters related to waste management, and in this case, talking about COVID-19. So welcome to this roundtable, and I'll see you soon.
Thank you, Anna. So let's jump into our questions. The first one is for Carlos. So Carlos, my question for you is that how has COVID-19 brought greater attention to the waste industry and the personnel involved in the industry? And how can we keep this momentum going?
Thank you, Daniel. And I'd like to express my gratitude for all the efforts made by the ISWA General Secretariat to put this roundtable together, and all our members and sponsors, as you mentioned, and who have been working very hard to ensure that we will cross these difficult times safe and with better knowledge than before. During this first phase of the pandemic, and in early 2020, almost 1 year ago, we got together to discuss and try to guess what would be the impact of COVID-19 in the waste industry. At that time, we joined most of the knowledge and experiences within ISWA, and produced some materials, some recommendations, which are being used by several other institutions all over the world since then. And from that time, we reached 3 main conclusions for which we dedicated most of our attention and directed our efforts. So these 3 main conclusions are: waste management services are essential in everyone's life, and this should be emphasized in our daily lives. Secondly, waste workers are part of the most important sanitation barrier in every society. Thus, they are essential workers and deserve full assistance and protection. And here an important clarification, and we also realized it during this period of the pandemic, is that waste was not and is not a direct vehicle for transmission of the new coronavirus. And but additional packaging measures at home and some additional operational guidelines were required, developed, and presented by ISWA. And thirdly, due to the lockdown and social distancing measures adopted in different parts of the world, new waste types and generation patterns have been registered, and increased amount triggered a more attentive behavior by individuals. So we also got more attention from the society. So in summary, I would say yes, COVID-19 brought a greater attention to our industry and to its professionals, who implemented all efforts to keep our cities clean no matter what, and up to now very successfully, by the way, because we didn't register any waste crisis during this period. And in order to keep this momentum, in order to look towards the future, I would say we must build this future based on the experience achieved up to now, showing that this industry is not an invisible one and deserves better value as one of the pillars for the green recovery during the post-COVID. Our workers are daily heroes, and it's important to keep our recognition towards them. And also this moment showed that people can be sensitive and engage themselves in good causes when called to action. As a science-based institution, ISWA will keep its role, disseminating the best knowledge, working to accomplish our stated mission to ensure sound waste management is in place in every corner of the world, to ensure that most common citizens realize it's their and our basic human right to have sound waste management services. As we have been saying for quite some time now, our work is about people and not waste. So we are really looking forward to keep this contribution, to keep our role, and look forward to working with all of you and helping to accomplish this mission. Thank you very much.
Thank you, Carlos, for those very positive words. And I think everyone on the panel and everyone watching really shares your gratitude and appreciation for the essential people helping to collect and sort our waste at the moment. And I think that this has been quite well recognized over the last year. The next question is for Björn. Björn, what have we seen in terms of the dynamics for municipal solid waste during this period? And do you notice any trends which might be uniform across the world?
Well, uniform trends are always a tricky thing, and there are always variations, of course, but there are some indications and some general aspects what seems to be general here. One of them, of course, is when we're looking at lockdowns, we have seen a general trend of more household waste or waste generated in households. In the parts of in areas where we have been locked down due to obvious reasons. People are more at home and less at work, and that affect swings on, of course, on the what kind of society and what kind of industries you have in your region, so to speak. For more work out of home, less evident is this effect. But we have seen more households. We've also seen less waste from commercial and workplaces, which of course is the other side of the coin. Some investigations indicates that the rise in waste from households is actually smaller than the fall in is actually larger than the fall in commercial and workplace waste. So we basically have seen less waste generation in some areas. So that's in general trends. Slightly lower waste generation, more waste at home, less waste as households. And of course, we have seen a surge in or a rise in packaging waste. We have had more takeaway. There's been more internet trade and trade going on via the internet than in real stores for part of this period. So that's also one effect. And of course, protective gear from the healthcare sector has also been a rise, but I'll leave that to Anne to elaborate more on, I guess. So that's general. When we can see something, that's on the generation, and that's on the collection. As Carlos said, we have seen that the waste management sector in general has worked well through the pandemic. Where we have seen disruptions or fluctuations is on especially on the recycling markets and the markets for recovered materials, where we from one part have seen disturbance in the some value chains and an economy in a lower gear in some parts of the world, but also had affected the demand for recyclables and thereby the recycling sector, as well. But we also have seen informal or less formalized workers having a harder time to be able to do their work during the pandemic, due to lockdowns, due to fear of waste being a vehicle for spreading the disease, which has shown not to be a large factor. However, it did affect the system in some parts, but especially hitting informal and less formalized sectors in the waste sector, as well as in other sectors from doing their work, which kind of stresses also the need and the recognition that waste management and waste management collection is a crucial public good, and it is important that it also works during harder times and pandemics. Thank you, Daniel.
Okay, thank you, Björn. And the next question, I'm going to jump back to some of the things that Carlos might have touched on. This question is for David, because at SWANA, you've put a lot of emphasis on waste workers during the pandemic. Do you think that waste workers have been sufficiently protected against COVID-19? And tell us a bit more about the status in the United States at the moment.
Sure, Daniel, thank you. First of all, I agree with everything Carlos and Björn said. There have been some significant changes in where waste is being generated, but I also agree that there's been increased attention to the sector, and I think this provides an opportunity for ISWA and others who care about waste workers in the waste system. Speaking specifically now to the question asked about safety, most waste workers wore personal protective equipment, at least in the United States and Canada, before the COVID-19 pandemic. People wear gloves. People in facilities wear masks because of dust. And so this provided a measure of protection against contact with the coronavirus. At the beginning of the pandemic 1 year ago, we were concerned about getting COVID from touching the cardboard or touching the metal that was being picked up at the curb. Turns out that that's not an effective way of transmitting the disease, but being close to another person in an indoor environment is an effective way of catching the disease. And so social distancing inside of facilities has been a very significant priority for the waste industry in the United States. So what that means is that at recycling facilities, we've had to separate pickers or people who are doing quality control on the recycling line and move them away from each other, or put plexiglass dividers up between them. And in some places, this was disruptive as those changes were made and facilities were closed or not working at their full capacity. But now everyone really understands how the how the coronavirus is transmitted. And so therefore, we're seeing much less in the way of transmission or the hazard of transmission that there might say. It's really important to remind the workers to wear the masks and the goggles and the gloves all the time. It's for their health. And I see the question from Mexico, from Ian, about this issue. There is a little bit of resistance to wearing masks and wearing gloves. But at least here in the United States, when people have seen friends and family and coworkers get the disease and sometimes very sadly pass away from it, that's a very effective motivating tool to get people to wear masks and other personal protective equipment. The other point that I just want to make around the safety space is that despite the use of PPE and despite these operational changes that many have made to distance workers from each other, we're still seeing workers, people in the industry get COVID, but they get it from community spread. They get it from home or from activities outside the workplace, which is continuing to disrupt collection in certain parts of the United States, even though many people in the United States are being vaccinated. And so just in the last few weeks, we've seen delays in several parts of the United States that have been reported in the local media. So our work in this area is ongoing. We need to continue to educate workers about the need to wear their personal protective equipment, and now we need to remind workers about the need to get vaccinated to protect themselves against the coronavirus. Thank you.
Thank you, David. Actually, a question just came up in the chat, and maybe I'll ask it right away because it kind of follows on from what you're saying, and maybe this is a question to everybody, but in your respective countries, have waste workers been prioritized for vaccinations?
Oh, that's a terrific question. If you don't mind, Daniel, I'll answer that first because SWANA spent a fair amount of time in December and January trying to convince our Centers for Disease Control to prioritize the waste sector and put us towards the top of the list. We were at best marginally successful at that. And then as the vaccines began to be distributed in the United States, states began to change the CDC recommendations because older people had not been prioritized in the CDC recommendations. And now in virtually every state, those were the first people who were vaccinated. In most of the United States, even before April of 2020, the month we're currently in, the waste sector was prioritized as an essential workplace in what's known as Group 2 in the way the United States was distributing the vaccines. In a couple of states, the waste industry was prioritized ahead of Group 2 in one of the first groups. And a couple months ago in South Carolina, our South Carolina chapter actually testified in the state legislature about this and warned what would happen if it got to be summertime and the industry was not yet vaccinated and garbage was remaining on the streets. But we're fortunate in the United States that the vaccine distribution has been swifter than had been anticipated several months ago under perhaps better leadership from Washington, D.C. And so I'm hopeful that anyone who wants the vaccine will be able to get the vaccine over the next month or so. Thanks, Daniel, for that follow-up question.
No problem. Thank you, David. I will ask the same question to all the other speakers when I move on to you, but I will ask a question now to Anne. Last year, we spoke a lot about PPE, and I think that we understand a lot better now the implications there, but what's the status with, what are the new challenges with the vaccine rollout for healthcare waste?
Thanks, Daniel. And I follow on from the other speakers just to say that, you know, waste workers, I'm based in the UK, but waste workers are seen as key workers. In terms of PPE, we are seeing a phenomenal amount of PPE. Some of it uses medical in the medical scenario. And I see a question come up in the chat about, are you likely to catch COVID from medical waste? Again, this is not transmitted through fomites, like the evidence suggesting that it is transmitted through close contact. So as David was saying about worker contact, it's also transmitted through social events and socializing. But in terms of contact, it's a close personal contact, not a contact with a surface or a waste particularly. And again, as Ian has commented, yes, we do expect people to wear PPE, but do they always? Just to put in context some of the numbers, we've had in the UK alone 10.4 billion pieces of PPE distributed in the last year. A lot of that is still being classed as infectious medical waste, when in reality it's not. Some of it will be, because there are, and I have to say this, you are all probably expecting me to go, other pathogens are available. So please do not just put this all like COVID and SARS-CoV-2. There will still be other pathogens in medical waste particularly. So don't forget those bloodborne viruses, please, when you are looking at disposal of PPE. I think that the volumes are significant. We have to manage them as a socially distanced waste or a physical distancing waste in a lot of scenarios, because they're going to be around for a very, very long time. What we need to do is make sure that we assess those and manage them properly. The majority of them, in fact, I would say all at the moment, to my knowledge, are not recyclable. So we don't want them ending up in a recycling stream. So there is that mid-ground of expecting to see them in a domestic or municipal type waste stream. Again, workers should be protected. from other pathogens. As I say, yes, we want them to have their COVID vaccination, but if they're working with waste, we want them to have the other vaccinations that we'd expect them to have. In terms of the global rollout of the vaccination program, this is huge. So far, globally, 925 million doses of the vaccine has been delivered. So that's 925 needles and syringes, 925 million needles and syringes as well. The COVAX program, so that's for the low and middle income countries. So far, 61 countries have been started to be vaccinated, which 61 of those are out of the 92 low and middle income countries. UK, we've delivered 33 million doses for first, and 10 million people have their second doses. When you start to think of that in the context of waste, not just the waste workers, that is a lot of waste. That is tons and tons of waste. In terms of the vaccine itself, and in terms of hazard, because I know I keep coming back to risk and hazard, but in terms of the hazard, there is very little hazard from the vaccination itself. So it is a genetically modified protein or a messenger RNA. So in countries where they don't have access to pharmaceutical disposal, it's perfectly suitable for an autoclave. Coming back to the original question, has this been rolled out amongst healthcare waste workers? Very much like in the US, in the UK, certainly the model has been around age and vulnerability rather than your key worker status. There will be people in the medical sector and the education sector that have had it. In terms of waste, again, in my opinion, I think too much store is put by PPE, but we should be also protecting against dusts and molds and other pathogens. So the PPE should be our final form of protection. Has the status changed for the healthcare waste workers? I don't know. I think we still need to look after them. I think we have to promote them as key workers. I think healthcare waste has tripled, if not quadrupled in some countries, and we have to ensure that we continue to treat healthcare waste as well as all other wastes with the respect that it deserves. And it doesn't matter whether it's SARS-CoV-2, whether it's norovirus, we have to be consciously aware that we have to look after our healthcare waste workers specifically. Thank you. I'll get off my soapbox now, Daniel.
No problem, Anne. Thank you for the interesting answers. I want to ask a question now to Anna. We're also talking about people. And how have you managed to deal with the challenge of defining messages to communicate to such a broad audience? Do you have any myths and fears that you've had to kind of extinguish amongst your people?
Yeah, thank you. Well, yes, we're talking about people using different kinds of new things that didn't exist. We never used masks to go out like now, as Anne told to everybody. We have a lot of new waste streams that we need to take care of. And my work mainly is to work to the people. And as we saw with the lockdowns, people went home. So if they went home, they started to produce their waste at home. And the challenge here is to communicate with them, telling them what to do with rules. And when it's all started, people were so afraid of getting infected, on having rules on how to deal with their health, with their family, with schools, with their work. And waste was really the last topic they wanted to think about. And when they started to think about it, they simply, they had fear to touch it many times. So our communication messages were very focused on rules, specific rules, to use the mask, to stay at home, but also to put the waste inside a bag. In some cases, if you were infected, 2 bags, to make sure that the waste is inside the bin and not outside the bin. All of these were very simple messages, but we have said it not enough. Even to put the masks not in the containers for selective collection, but in the containers for mixed waste. So these are very simple messages that we needed to say it over and over again. Even now, after 1 year, these kind of messages are really the ones we need to emphasize. To better explain this, I will share my screen with you, because I'd like to share a presentation of what we have made here in Portugal, especially and with more emphasis during the first period when all this started. So I think that you all now are seeing my screen. I will just share it. Okay, so this was a campaign. We had the need to do it, so we went digital. This was quite an opportunity because people were at home. Many people have the smartphones, so this is a very cheap way and effective way to communicate what we need to prevent. So we made a website specifically in 3 languages, Portuguese, English, and Spanish, which is still online, with all the messages and of course strong communication with workers about new rules, how to use the protection equipment, or they already had it, but of course we needed to make it with more strong positions. We used emails, SMS, and social media. So this is quite a metamorphosis for us. We didn't use the social media as strongly as after the first lockdown. We went to televisions and made a lot of interviews saying people what to do. At this point, the messages about waste management in households were not so spread, and we made a social media campaign with our workers. One of the most important things of this was this came out without asking them. They were the ones saying this, and the posters you are just watching, they're saying, stay at home for us, we are working for you, saying that they are in the front line and they would do better their job if people were just following the rules. So this campaign went viral. We made them the stars and the heroes of the waste management, and as I told you, some social media campaign saying very simple messages like put your masks, gloves, and tissues in the common waste. We even made a specific information with an app where you can find where your containers are located, and simple messages with videos like this one, just telling what to put inside each bin. So these are just examples. Another one is to keep the animals away from the bins and keep the area clean and disinfected. So simple messages. One of the myths that went up, that we have faced, was people were afraid of touching the tops of the bins, so they were keeping them open, even if there were raining and wind. So we just told them, please keep the tops closed because we need you to keep all the waste contained. Even we have to ask people that were making changes in their homes because they were locked down and they had time to make some make some arrangements in their houses. So we asked them, please don't put it aside during the lockdown period. And other messages like these ones of telling people what to do. And we started to receive these kinds of messages in the bins. People saying, thank you for your job. We really appreciate it. Thank you for collecting our waste. We are our daily heroes. So all of these were messages that we are collecting every day in our area of concession. Some other examples I brought you. Something happened also with healthcare centers for older people. Diapers were appearing in a huge amount in the selective containers, so we had to make very specific campaigns related to diapers. And Who Says Diaper says other things that appeared in the containers, and we have just put a big emphasis on some specific messages spread by digital media. So we had some results, incredible results. During the last year, we had 22.7 million impressions of awareness campaigns. The amount of budget was not so high to do this, and this was incredible spread because there were no messages spread enough to tell people a specific message. And the importance of this was that we spread it to the municipalities, and we had high dissemination, and this is still ongoing in 2021. So like posters and leaflets saying that contaminated waste, it's not recyclable, and posters and leaflets also for our workers. And also we have also made a film for ISWA that is available online. So this is what I wanted to share with you related to what we have done in my country. Just to finalize, yes, there are many myths and fears. We need to address them directly and say exactly what people have to do. trying to make it simple as more as possible. Thank you.
Thank you, Anna. I have a follow-up question for you. In Björn's answer, he discussed the possible net decrease in waste generation around the world, but maybe you can tell us what your experience is in a country where tourism generates a lot of waste. What's been the impact on waste generation in Portugal?
Okay, so EGF takes care of about the waste management of about 60% of the population, and we had different experiences. For instance, in area of Lisbon and Algarve, which are very touristic regions, the waste, of course, went very down because we don't have tourism so much like we were supposed to have. But another interesting fact was that people went home and we recycle more at home. So we have cities around Lisbon or in the interior of the country that the waste streams really went up in confrontation with cities with tourism that the waste streams went down. So it is an interesting comparison because we had two moments, the lack of tourism, but also the movement of the population. And we also see it when they buy their houses. There are already families going outside the cities because they are working remotely, and even schools, they had a lot of time working remotely, so they are producing waste in different areas than they were before. So this implicates some management, and some other companies had to adapt to this new reality. This is still going on, but this was a fact in our country.
Thank you, Anna. I have a question now for Björn from one of our audience. Has anyone experienced the separate collection for waste generated by people who have tested positive and are they managed as infectious? This is apparently a contentious issue in a lot of municipalities still.
It's actually a good question, and I haven't heard anything either way here. So I will actually pass the question further on and ask, for example, if David or Anne has any indications on that.
Daniel, am I okay to jump in on that one?
Of course.
We have looked at this in detail. So again, it's not about fomite transmission from waste. So a lot depends on if people are self-caring at home or if they're having carers in. What we have done in the UK, and again, that is under review because we're not sure whether it's actually necessary. We have requested people store their waste for 72 hours. So 3 days prior to putting it out, because we know that the SARS-CoV-2 virus isn't going to survive on waste in that period of time. Because again, we know that the transmission is through close contact. There will be other, if somebody's got sickness and diarrhea or norovirus or something, then those wastes again are of a risk. So we also know that there are other hazardous, as in pathogenic type wastes in our healthcare waste that aren't necessarily infectious waste. So again, it is about treating those wastes with the respect that they deserve. We have food in there that's going moldy, etc. But in terms of catching SARS-CoV-2, catching COVID from waste, it is highly unlikely because of the mode of transmission. So they haven't been put out as an infectious clinical waste or even an infectious waste. They have been allowed to sit there and then they go out as a municipal type waste. I don't know whether that's the same for you, David.
Yeah, Anna, I agree with everything you said. What we've seen in the United States quite a bit, though, is because most of the waste is collected in carts or some sort of container, there is multiple barriers between the waste that might have been coming out of somebody's house and the worker who might touch it or touch the container that then places it in the back of the truck. There has been an increase in local governments moving away from bags and promoting carts as a way to manage municipal solid waste as a result of the pandemic. And I think that's going to continue even when the pandemic is over.
And also to share and endorse what has been said by Anne and David, what I've seen in here, I'm based in Brazil, so what I've seen here in Brazil and in many countries in the region is that household waste has not been collected separately because it's not operational. And as David just mentioned, we followed some of the instructions Anna presented to teach people and guide people to have like a double packaging of the waste in two plastic bags, and then it's collected by trucks without direct contact by the workers and the waste. So, and it goes into the compaction truck and then to the final destination. And the most important guidance we gave is that these waste should not be touched by anyone, because unfortunately in many developing countries we still have open dumps. So this waste during the COVID pandemic is really disposed of and covered on a daily basis. And recyclables, people should take this additional attention Aim just mentioned, to keep it for 72 hours in their houses, because it's dry waste mostly, and then it goes to sorting plants, because usually we also have manual sorting plants in the developing countries. So and what we've seen, and this I think it's important to share with all of you, is that contamination rates from the operations related to waste management have been kept at a very low rate in the many different countries from which we received data. And as David mentioned during his first intervention, most of data nowadays shows that it's a communitary, a social disease rather than an industry-based disease. So we don't see many workers being contaminated through waste management operations, but from their communities, from their homes, from their families, and this unfortunately causes some damage, some problems to the waste system. And another experience here in Brazil, that several companies had to hire additional workers and train them during this period because of the layoff for many workers, and but it has been adopted and kept in a safe manner. Thank you.
Thank you, Carlos. I have a question here from Derek Greedy, and he mentions that health and safety has always been an issue for this industry, and he wants to know if the pandemic has helped or hindered the industry in their quest to improve our health and safety record. And I guess this is a question for David.
Sure, Daniel, thank you. So I think when we look back on the pandemic, we're going to see that the frequency of fatal incidents and accidents and injuries will have gone down during the pandemic compared to previous years. I think that's for a number of reasons. Number one, the frontline workers, who are the ones who tend to get hurt, not supervisors or people who work at desks, they're more health and safety conscious because they're working in the middle of a pandemic. So they're wearing their PPE. They're maybe being a little more careful. So I think that contributes to what I expect to be a reduction in the numbers. The other important factor is the substantial reduction in traffic that we've had, at least here in the United States, as a result of COVID, particularly during the first 6 months of the pandemic. One of the most frequent ways that our industry has workers get hurt or has safety issues is from collisions with other vehicles. And if there are fewer other vehicles on the road, the likelihood of collisions is less. One of the concerns that I have as we start to emerge with the pandemic, and we'll talk about this, I think, in a future question perhaps, is as people come back to work and as they start to drive more, I'm concerned that we're going to see an uptick in collisions. And so we're going to have to be reminding our frontline workers to be prepared for that. Thank you. Good question, Derek.
Thank you, David. I've had a lot of people comment in the chat now about the
possible. Can I just comment on David there as well, or actually, I think you're totally right, David. And I think what we have to do coming out of the other end of this pandemic is, of course, remind the sector, ourselves, and the communities on where the hazards are and still will be. And as you're bearing in mind, it's a reversing vehicles, it's traffic injuries, it trips and falls, and it's moving parts in sorting plants and burns at energy plants, for example. And those will be there, has always been there. And we just have to make sure that we're not overshadowed by new concerns, because these are real and will be there. And of course, as you say, when we come back, there will be more traffic. Unfortunately, more traffic again as well. Yes. Thanks.
Thank you, Björn. I was about to mention that I've seen this come up a lot in the chat about just the general waste generation, and Anne mentioned that we've received so far 925 million vaccines have been issued, and that's an absolutely phenomenal amount of waste. And how in countries where they have very limited waste infrastructure already, how are they dealing with this challenge? Maybe does anyone want to try and address this question?
I will, because I'm working with the panel that's supporting it. So ISWA is actively supporting the UNDP, UNICEF, MSF, CDC, WHO rollout of the COVAX programme. Ruth Stringer, who is one of our members, is also heavily involved. So we are looking at making sure that where vaccines can't, we would normally say it's incinerated, it's a pharmaceutical, we're looking at alternatives for that for the low and middle income countries. There is one aspect that I really should raise that is completely never we would have expected in a million years. In December, the first thing we had about the vaccines, we have to be very careful with the branded packaging and the vials, because they are of interest to criminals who want to counterfeit medicines and put them back on the market. So we're having to be very careful with that. So the COVAX program and the supply chain who are delivering are, where possible, we're trying to get a lot of the waste brought back as well and managed centrally, so they don't fall into the hands of criminals and nefarious people. So there is a genuine, serious security aspect around the vials and their vials and the outer cartons and packagings. And as I say, that's something that we're very aware of. Some countries are autoclaving the vaccine waste so that then they can granulate the plastics and possibly recover the plastics. Yeah, it's a large program, but the vaccination contents themselves, the contents of the vials and the needles, the contents of the syringes, are not as hazardous as some other pharmaceuticals. As I say, it's a biological vaccine, so there are more disposal options available to people to get rid of it.
Thank you, Anne. I saw a few comments also in the chat that there has been a significant increase in the use of plastics and single-use plastics throughout this pandemic. Maybe Björn, have you noticed this? Is this true?
Yeah, there is, of course, PPE is one part, but also a small part, one part of it. But as well as it's mentioned earlier, new consumption patterns for people working from home, ordering things on the internet, getting more packaging, both cardboard and plastics actually, and also a lot of more takeaway food, more packed foods throughout societies. So it's an evident change, and also of course a change again, following up on Anna's reflection on waste arising at another place when there used to be arise, so to speak. People living in different places, people being at home and still at work, or buying things live in town. So yes, definitely have seen that effect.
Daniel, and if I may add to what Björn's just said, this is something that has been monitored in different countries, not only the increase of plastic waste, but also the increase in littering in many places, and it's also posed a challenge to the waste industry, and we need to deal with that. But it's not only a situation that we need to collect and give an adequate destination to those wastes, but to better teach people and engage people towards waste disposal or throwing out things to the right places. And but here it's a phenomenon that we need to deal with because the increase in the amount of plastic waste, it's also a consequence of this pandemic to prevent COVID transmission, because people felt they were safer if they use, let's say, disposable items in order to protect their health, instead of using reusable items in different places. So this is also a social perception that we need to be prepared. And just as another issue to mention, tomorrow we will have I will participate in a roundtable promoted by the IDB, the Inter-American Development Bank, with several speakers, and the focus is COVID-19 and the plastic pandemic. So this is a specific topic we will be dealing, we will be researching and reflecting about better solutions.
Thank you, Carlos. I have another question from one of our audience now. What are your thoughts on having specific guidelines for handling solid waste during the crisis of pandemic? And should we have guidelines in general going forwards?
We wrote some in the early days. We've done specific guidance has been written. I think I've answered the question too. So Waste Aid have produced guidance, WHO have produced guidance, and so have ISWA. ISWA have also done some training, made training available. So I think that I would like to see a more generic guidance, I suppose, going forward, because SARS-CoV-2 and COVID-19 is a respiratory pathogen. And I think we need to be aware that these aren't the only types of pathogens that are out there. So I would like to see a higher level of preparedness for future pandemics, if that's not too big an ask from the entire industry.
If I could just add on to that for a moment, along with ISWA, SWANA issued guidance to its members in North America on how to handle waste during the pandemic, but we did that in April of last year, 1 year ago. And we know so much more than we did 1 year ago about this pandemic and how to manage waste appropriately. And I'm almost embarrassed by the fact that we have not sent an update on this. And so actually, I just sent a text to somebody on my staff to get working on that project. So thank you.
Great. I'm not sure who wants to answer this question, but has there been a significant change or innovation in terms of chemical, radioactive, or in hazardous waste facilities and systems from health facilities during the pandemic? I guess it's for Anna also.
I don't think there have been a particular uptake in new technologies, because I think that the frontline workers have been so busy just treating people. The healthcare sector across the entire planet has been stretched to capacity. So while there have been a lot of us in the background, and I include myself in that, looking at alternatives, it's very hard to change something when it's stretched to its maximum. However, I can tell you that people across the globe are looking at all sorts of alternatives, including things like reusable PPE. I've just seen a question on the recycling of PPE. I think we have to make things that are recyclable, decontaminatable, whatever phrases you want to use, because we cannot continue just having billions of pieces of single-use plastic used as PPE. We have to be smarter about what we're using and what we're making in the first place.
Okay, thank you, Anne. So I'm going to ask you all now to make a short concluding statement, maybe 2 to 3 minutes each. I want you all to tell me in a nutshell, and tell our audience what we've learned over the last year, and give us a couple of positive messages going forwards, and just tell us how the waste management industry has learned and how it's progressed because of COVID-19. Let's start with Anna.
Okay, so the way I see the futures and lessons learned, so we learn to communicate better, simpler, with our workers and with the people with specific rules. And this is something, it's an opportunity to become more digital. People are more at home. We can make messages simpler and get to them through their phones. So this is something I think we have learned. But as we can expect, of course, we are all expecting the vaccines, expecting that everybody as much as possible gets vaccinated to have more normal life without masks and all of that. We hope we have that as soon as possible, but until then, we still have a long path to go. It's different between countries, and it's also very important. For me, it will be a dream not to have vaccines, not only for for Europe and America, but also for all countries, because today is Earth Day. So vaccines should also be think about for Earth and for everybody. This is something it's spread very easily, like we have seen, and so let's hope that practices goes everywhere, like we are doing right now. Thank you.
Thank you, Anna. I will hand to Björn next.
Apologies. Well, I would say, of course, what has been good from a perspective and learning to take care is, of course, which we should use any place where we can do to talk about health and safety and stressful situations, be adaptable to situations, and make sure that our workers, our colleagues are safe and sound, as safe and sound as they can be, and using the situation for that. I would say both from that perspective and also on the societal role of waste management. I will also say it's the good message here is that the sector has stand the challenge. We've been working, having good work, good communications on health and safety. In many places, also waste management, the waste management systems has worked well during the pandemic. Of course, there are disruptions and things to do. The last one is, of course, we've seen disruptions. We've seen waste generation in new places. We have to expect that to continue to happen as well, because people have also seen, pandemic or not, the possibility to work, act, and do things in different ways. And that also calls for the sector, I think, to be able to be more flexible in the way we plan, collect, and service societies. Thanks.
Thank you, Björn. David.
Thank you, Daniel. I'm going to build on a couple of things that were just said. First of all, I think perhaps the biggest silver lining to the pandemic for the waste sector has been the sector's increased focus on health and safety. By having the frontline workers and supervisors and management all concerned about health and safety issues, it by definition makes everybody in the chain of command care more about the health and safety of the workforce. And it's my continuing thinking that this is going to be a great knock-on that continues going forward post-pandemic. Will be an increased focus on health and safety. And in the United States and Canada, we always think about safety, accidents and collisions. And there's a little less focus on the health part of that. The pandemic has forced many companies and local governments to focus more on health, which I think is going to be important. Another positive thing that has come out of this is that companies and local governments have learned to be flexible. This industry is one that is very good at doing the same thing over and over again every day. And we've learned that we need to be flexible and amenable to change, an increased emphasis on digital, as was said earlier. And I think that's going to continue as well. One of the other lessons learned is that we need more resources. I think we resource waste collection and disposal for sort of a typical day. And as was mentioned earlier, when waste generation goes up on the residential sector and you don't have the right number of trucks or people to collect it, it creates disruptions. And so I think we're going to need to be more vocal as a industry, as a sector, in demanding more resources from the elected officials who make funding decisions. And the very last thing that I'll mention, and this is a real cause for optimism, and I think the United States in particular is probably ahead of other countries in this area, is that the business is coming back. As the business community starts to reopen, commercial volume is going up, and going up more significantly, I think, than had been originally anticipated. This means that there's going to be more opportunities for both governments and particularly the private sector to run more trucks, collect more money, invest in their infrastructure. So I think that's going to be another positive that we see in the United States. And we'll be hearing more about that, I think, over the next month or so. But there certainly has been an acceleration in the US in particular. Canada's lagging behind the United States in reopening. There's definitely been an uptick in business activity in the United States over the last month or so as vaccines have become more widely available. Thank you.
Thank you very much, David. Anne.
Hi, for me, it's all been about raising the profile. Some negatives on profile raising because it has, well, I suppose it's a positive, it's raised the profile, but unfortunately we've found a very significant environmental impact on marine litter. So we've seen a lot of PPE, masks, gloves, etc., ending up in marine litter. So that is a bit of a negative. But again, we have seen a lot of publicity from that. Following on from David's comments, I absolutely think that the profile of health and safety has been raised. And I also, which is something that hasn't been touched on yet, I also think the profile of mental health and safety mental health has been raised because people have been under an intense pressure. So I think it's more acceptable now, and employers are more aware of not only people's physical health, they're also more aware of their mental health and mental health status there. A big positive for me is that we have absolutely 100% got healthcare waste workers and waste workers as key workers. They are fundamental to our infrastructure. So that's a very positive thing that has come out of this, if you can have anything positive out of a pandemic. But the final thing I want to think about, and I've already touched on, is that I want to look at better product design for a range of things, but particularly where we are having to use PPE, we need to start looking at doing this in a more sustainable manner, because I think sustainability went to the bottom of the agenda, and I think it needs to start rising very, very quickly up the agenda. So we start using a lot less single use and a lot more safely, well-designed reusable items.
Okay, thank you. Thank you. I did notice someone in the chat actually made a comment that in Sweden they are looking to use bio-based aprons for the hospitals. And
yeah, we have those here, but again, it's no good if you're going to end up putting them in infectious waste stream and they're going to get incinerated or alternatively treated. It's about capturing them. Thanks.
All right, thank you. So when the final conclusion comes from Carlos.
Thank you, Daniel. Thank you all. It's easy to speak after such amazing experts and good friends, and thanks to all those who are following us until now. Well, I would say that now what we see now is that several countries and companies have been already talking about the post-COVID recovery. We've seen a lot being said about the COVID pandemic. Our approaches here now today were related to how better behave and support operations during the COVID, but many eyes are now looking to the post-COVID recovery, and there is almost a consensus that it will be a green and sustainable recovery. So here we have a major role for the waste industry, not only dealing with the pandemic consequences, but also and mostly with the daily challenges arising from increasing amounts of waste. This is a trend we've seen from many years now, and it has really been proved true, and we are seeing that waste is increasingly waste generation is increasing in many parts of the world, and mostly in developing countries. On another note, what we see is that there are increased pressure to fight against littering. So we talk about marine litter and we talk about street littering. And here, public campaigns such as the ones presented by Anna and environmental education, effective environmental education, gain increased importance. The on-the-ground experience mentioned by Ain gives us several lessons on how better we must deal with the different types of waste generated nowadays, and there are several myths involved with it. So it's important to follow scientific-based approaches. Remembering that we are massively loaded by fake news nowadays. So let's try to find scientific-based approaches, and ISWA is a hub for that. Regarding health and safety, it's already an issue for many years, and as David mentioned, it will be a permanent topic for the future, such as technological improvements, as mentioned by Björn and in the chat, have emerged as a need, and it's something to be planned according to each local reality and with fully funded, with funding fully available to that. Finally, I would say we are entering a new era for the economy with a more circular approach and less emissions, with constant monitoring by many indicators. ESG is now the new darling, the new normal, which will affect production patterns, consumers' decisions, and financing institutions. So it's time to adapt, it's time to learn and to grow from current experiences. And I must say, it's time to engage with ISWA, to become a member, to follow our events, to read our publications, because we have very interesting projects and groundbreaking news in the pipeline to support and guide the waste industry towards this new era. So thank you very much. It has been a pleasure to be with you today, and look forward to this connection in the near future.
Thank you very much, Carlos, and thank you to all of our speakers. It was very interesting to hear your thoughts on this. And I see there's a lot of chat going on in the box next to me, and you can continue these discussions by joining our working groups, or you can go to our LinkedIn page where we have lots of discussion groups, and we can continue. You can continue this conversation as an ISWA member, hopefully. So thank you very much, and see you all soon in person. Goodbye.
Goodbye. Stay safe.